certified dermatologist. I'm the medical director at the River Chase Dermatology location in Miami. And today on the Dermatology Download, we're going to be talking about maskne. And this is mask-related acne. You know, with all the time that we're spending wearing these masks, we're uncovering this whole new problem of maskne. And today I'm extremely excited to welcome Dr. Stacy Chimento here with me to talk about this interesting topic. How are you doing?
Thank you so much, Dr. Gonzalez. Honestly, I'm very happy to be here today and discussing this hot topic with you.
I know. I mean, we're suffering from it. We're wearing these masks for more than 8 hours a day, and we're having patients come into us every day complaining, what can I do for this maskne? I've never had acne before. I'm dealing for the first time ever with issues, or patients that had preceding acne, rosacea issues. It's just getting worse, and they don't know what to do.
And a lot of people, which is interesting, is that it really has become a real phenomenon. Like, it's a real diagnosis now, and it's true. And so a lot of patients ask me, what the hell is maskne, right? So, this is what I tell them. I say, look, we're constantly having to have this hot fitted mask on multiple times throughout the day. And really, it's almost like what we call like an acne mechanica, It's like where these football players wear these helmets, and then from the constant rubbing and friction, they're developing basically acne. And so that's what's happening around this area. We have this mask on. It's hot. It's sweaty. We have bacteria there. It's gross. But like that's basically what acne, this maskne is.
Yeah, exactly. We're favoring the environment where all this yeast, bacteria, malassezia, all these organisms that are normally there are just overgrowing. So we're throwing the complete flora, off. So no wonder we're going to be seeing a lot more patients with worsening of these symptoms, perioral dermatitis, rosacea, acne,
Absolutely.
You name it.
And, and that's another thing people are coming in and they're asking too. It's like, they're wanting to know about, like, and I'm sure, and I'm going to ask you this question, things about makeup, lotions, sunscreen. Like, do you find in your patients that it's making it worse? And like, what are you recommending for them?
Exactly. So what I'm telling my patients is the simpler we can go these days, the better. So I am emphasizing the use of moisturizer. So the barrier, one thing that I'm seeing, and I'm sure you've seen it too, with all this friction and acne mechanica type of phenomenon we're seeing with acne, the barrier, skin barrier is being highly compromised. So I think one way to replenish this, and what I'm telling my patients, is to start incorporating a moisturizer if they haven't done so, twice daily, ideally, a few minutes before applying their mask, to help strengthen that skin barrier. And I usually say just moisturizer, sunblock. Try to eliminate the use of so much makeup, because you don't want to create more clogging. And obviously that does, promote more pore clogging, especially if you're putting a mask right on top of it.
Absolutely. I think that's beautifully said, because it's really less is more when we're dealing with maskne, right? So, I mean, I don't know about you, but guys, this is probably like the first time you're seeing me with makeup in like 8 months. So there you go.
That's also the new normal.
It's the new
no
normal.
makeup.
It's true, but it's true. If you can really kind of cut down on all that heavy makeup, like you said, I love what you said about the protecting the barrier of the skin. That's so important. A lot of my patients say, well, I'm not going to wear moisturizer because it's going to make my acne worse. And the truth of the matter, guys, is that when your skin is really dry, what does your body do? It wants to produce more oil. So you really want to keep it a really good pH balance so that you can prevent that maskne from coming out more. And so again, beautifully said, guys, less is more with that.
And then Stacy, I'll definitely add on to that, the fact that since you mentioned the pH balancing, and that starts with proper cleansing. So another thing that I'm emphasizing to patients is you want to make sure you're cleansing before putting the mask with a pH balancing, gentle and hydrating cleanser. But when you take off your mask, even though you didn't wear makeup that day, or I know guys usually don't wear makeup either way, you want to remove all that debris from wearing that mask and all that sweat. You want to make sure that you do a very good job at cleansing it, but still doing it with a gentle pH balancing and hydrating cleanser.
Absolutely. And I agree with you. You know, where our tendency is with acne, we run to the store and we start getting salicylic acid, benzoyl peroxide. And so this will kind of get us into that segment about how we actually treat it, right? But I agree with you. I think a very gentle cleanser is the best thing. And, you know, maybe since we're kind of already talking about this, like maybe, you know, you tell me what some of your treatment options, and then I'll kind of chime in on that.
Yeah, of course. You know, we've talked a lot about prevention, but how do we treat it? You know, once the patient's already there, I really like to start incorporating some mild retinol into the nighttime regimen, but you know, it could be very irritating, Stacey. I'm sure we see it every day because we use it for aesthetics. You know, it has so many benefits, wrinkles, pigmentation. But now that we're using it more for acne, I tell patients you want to go with a gentle retinol. So you could start with an over-the-counter formula, and you could just do it once, twice a week, as long as you also pair with a moisturizer, and gradually increase its use. I'm also talking a lot about spot treatments. You know, sometimes patients just get a few isolated lesions. So I say, you know, grab that sulfur mask and kind of spot treat with that, or benzoyl peroxide, just spot treat. If you put it all over, it just may cause too much damage to that skin barrier that we were talking about. What else do you do, Stacey?
I mean, I'm pretty much on the same with you. You know, the only thing I'd say, again, it's we're wearing these masks, and these masks are very occlusive, right? So, you know, that's one thing we have to take into consideration, is that we have these tight fitted masks. Anytime you start slathering on benzoyl peroxide or spot treatment or salicylic acid, I mean, you're still running that risk of wearing the mask, that it's going to penetrate more and actually do more harm than it does good. So again, I would say less is more. Maybe avoid using any sort of spot treatment during the daytime when you're wearing those heavy masks. And I love retinoids, or even adapalene, which now we have different over the counter, which is great, because it's going to get those cells to turn over, and it's really going to help pretty much with all the different aspects of acne and anti-inflammatory nature. But I agree with you that cleansers really should be gentle and mild. We really need to start having that trend of not, you know, we want to blast that acne right away, and that's great when we're not like wearing these masks all day. But less is more. And again, that's just my key for everything there. And what do you think about like hair follicle, like beard? I mean, because now we're going to talk a little bit about our guys here, right? So, you know, with the beard, do you think, I mean, is there the treatment options would be anything different from them? You know, again, I see a little bit, you know, we get more irritation or dermatitis, like seborrheic dermatitis.
Again, yeah, I see the same thing. I just think a lot more oils and sweat does get caught up in, you know, in between the hair. So I'm telling my male patients, you know, try to trim your beard a little bit more. I know that's really in right now, to let it grow, and but unfortunately, you know, sometimes when you let it grow too much, and now with a mask now causing all that friction, and as I said, all these pathogens, you know, we're talking bacteria, yeast, sweat, all that stuff just gets clogged up in between those follicles and that longer hair. So I think keeping it more trimmed will be advisable. And that's what I've been telling a lot of my male patients, obviously, besides doing some of the treatments that we already discussed.
Absolutely. And I'm the same on board with you. Again, there's a lot more oil production there. And obviously, if you have very sensitive skin and you are, you know, you have to shave the area, then sometimes one little tip I tell them, I say, get a little 1% hydrocortisone cream at home, you know. If you get a little irritation on the perioral area, especially after shaving, you can put a little bit of that hydrocortisone cream, perhaps at bedtime. So that way you can still get that benefit of protecting the skin from Maskne, basically, but also being able to soothe the skin. And again, men, the same thing. They need to do gentle products. Make sure you're using, just to prevent from that aftershave, using some nice sort of shaving creams.
I know they love to do it with soap. I'm like,
so,
the one.
My husband does it. It's terrible. It's like, come on, you know. And wash your mask. So that's one thing I'm going to ask you. Is like, you know, patients ask, like, what do I wash my mask with, you know? And, you know, we see a lot of different things here. We have patients that have very sensitive skin with rosacea, sebderm, eczema. And so I'm a big firm believer in using fragrance-free products to wash the masks. Even a lot of right? Even a lot of times if you use, people want to start using like bleach and weird household items are very strong alcohol based, you know, that's just going to cause further irritation. So plain old soap and water, fragrance free, I think is the way to go. What do you think?
Oh no, I totally. I'm a lot about that fragrance free. I said fabric softeners and all that, you know, nice fragrance. We gotta leave it out of the equation here, because then we might bring out another problem. You know, the skin be more susceptible. You might have an allergic contact to the fragrance of the detergent. And that's not even talking about the possible irritant and allergic contact to the material of the mask, which brings me to another point. I do recommend to wear, you know, the more lightweight fabrics, the ones that are less likely to cause friction. I know they're not the most protective. And when we're in this field, the healthcare field, we have to stick to the plastic or polypropylene, you know, types of masks that we have to wear. But for those patients, their exposure may not be as high, and they're suffering from these problems, they can perhaps consider a lightweight fabric like satin, cotton, something like that, that is less likely to worsen the, you know, to the friction.
I agree. And nowadays there's so many things. I mean, you go on social media, you pull up Instagram, it's like you can buy like 5 million masks there. And they're very light fit. Some of these, like you said, I like a cotton-based mask. I think that's pretty nice for the skin. And like one thing, it's just like, you know, it's so accessible, just buy a whole bunch of them. Like sometimes I'll
actually— It's a new accessory.
It's a new accessory now, but I suffer from it. Look, I'm old, I'm 42. It's like, I break out with acne too still. So, right? It's, I take
I thought you were 32. Stacey. What are you talking
please, lady. But I switch my masks out. Like I'll get a little cotton mask, like during the day when I'm at home with my kids or the weekend running around. I will actually switch them out. I mean, I have so many at home, and I think that's something to do. Keep some extra masks in your purse or in your car, and you know you can switch that out so you're keeping that grease and that grime and everything off. It's like I tell people, it's like underwear. You gotta wash your underwear. You're not gonna put dirty underwear right on. So it's like wash your face, wash the mask. You know.
Yeah, I use the same analogy. I'm like, it's exactly like underwear. You gotta wash those masks. And I do keep like 5 of them in the car, you know, not only because you forget sometimes when you go to places, you realize you forgot your mask in the house. So, but also to be able to switch them around. And I think if we have the disposable masks, which, you know, as I said, for work, we have to use them. We also need to find a way of switching them around and not wearing the same one over and over.
Any last tips that you could think of? You know, I mean, for me, it's just really, like I said, it's the basics. You know, you guys just need to wash your face, you know, keep it light on the products, fragrance-free, sensitive types of products, get cotton, you know, cotton masks or something silk, something light. And really, like if you're really developing a very bad outbreak, don't, you know, use us. That's what we're here for. We're here to help you. So whether you're sort of scared to come into the office, we have teledermatology. I know you have it also too, at your office.
Exactly, yeah. We're definitely still offering that, you know, for our patients. I think there's still some people that reasonably so don't want to come and become unnecessarily exposed, especially if it's just to discuss, you know, this new onset of maskne. So I think sometimes a consultation is needed because the over-the-counter remedies that we just talked about may not be enough. Exactly. So sometimes we need to treat them with oral antibiotics or topical antibiotics. So for select cases, I think that's a very reasonable advice to always consult with a dermatologist.
Absolutely, and that's what we're here for. So we thank you so much for spending this time with us. Thank you, Dr. Gonzalez, for spending your day with me too. And if you guys have any questions, Monday morning, any questions at all, please feel free to reach out to us, and we appreciate your time. Thank you.